Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning into the latest edition of the Checkup. Fueled by the Delta variant that's raging across the country, COVID cases are continuing to surge nationwide. And as we all know and have seen, hospitals in Florida are bearing a big brunt of this. The state accounts for nearly 18% of all new COVID cases, according to data out of Johns Hopkins University. I'm joined today by Aurelio Fernandez. He's president and CEO of Memorial Healthcare System, which operates 6 hospitals in the state. We're going to talk about how that surge is impacting staffing and operations down there. So, Aurelio, thanks so much for being with us today. I really appreciate it. I know it's an extremely busy time for you.
Sure, that's no problem.
So, I kind of want to start. We're recording this on August 12th. Give me a sense of where your system is right now in caseloads. You've got 6 hospitals, you've got some primary care stuff. What's your capacity like right now?
Yeah. We have experienced over the last 4 to 5 weeks, it's like a 400% increase in the number of positive COVID patients. We went from less than 100 to this morning, we were at 672, which represents about 40% of all of our inpatient census. 98% of it is still adults. We are seeing a slight increase in the pediatric space. And about 95% of those who are in the hospital, about 93% of those who are in the hospital were not vaccinated. So it is a change from the prior surge. Last summer, if I compare ourselves to last summer, which was the South Florida was the epicenter for the state of Florida, it was more like 51% of all of our patients were COVID related. Now we're at 40% today. And for the first time since latter part of June, we hit our peak that we hit last year, and that was 672, which we did today.
Wow. And so, as you said, 90, the vast majority are not vaccinated, which we're seeing across the country. What's the severity of those cases like?
Well, we're seeing less utilization of critical care beds being utilized. And for example, today we're at 14% of the 672 patients are in critical care units. We're using high flow instead of ventilators for the most part, which consumes a lot more oxygen, but we feel is more effective. They're sick, they're younger. Our mortality rate is not what it used to be last year because the population is younger, but you're looking at a two-week lag. So right now we're less than we were last year, and hopefully it'll stay that way. We have seen, Matthew, over the last 4 days that the increased number of COVID patients is much less than it was last week and the week before. We were experiencing 20 to 22, 23 additional new cases every day. Over the last 3 to 4 days since Monday, it's more like two or three additional COVID positive patients. And I hope that is a trend. And it's not just one day. And we had our Florida Hospital Association call today, and some of the hospitals in Jacksonville and in the Orlando market are experiencing similar trends, that it has narrowed. It is not the trajectory that the numbers reflected a week, 2, 3 weeks ago.
What do you attribute that to, that decline?
I do not know. The frustrating thing here is obviously the Delta virus is much more infectious than the one prior, because if you think about last year, when we had this surge in July and August, there was no vaccination. So here, even with vaccination, we're experiencing a similar level of activity in the hospital. I believe, quite honestly, is that we've taken the whole process not as seriously as we did prior. We're not wearing masks everywhere. We are not adhering to CDC guidelines. I mean, I went to a restaurant last Saturday. My wife and I were the only ones wearing a mask going in. Everybody else was unmasked. So I think it's just not adhering, being relaxed. And this is a much more infectious virus than what we had before.
Yeah, and before we jump into, I would really want to get into some of the staffing and how you're dealing with burnout and those things. But before we get there, I do want to ask, your state is also sort of the epicenter of a political fallout with your governor and, trading barbs with the president and the federal government. So how does that impact what you're doing on the healthcare provider side? Just that noise that's happening at that political level.
Yeah, well, obviously, it has become a political issue in the state of Florida. That's more with the education and wearing mandatory mask, and it's a person's right to do what they want to do. Here, we have the ability to exercise certain um, preventive process. For example, we don't allow. First of all, we don't allow visitors anymore because we do not want to have the virus spread and have clusters throughout the hospital. So we do require proof of vaccination that other services cannot. There's a Senate Bill 2006 that gives healthcare providers that right. So what we're doing is to maintain a safe environment for our patients, our employees, and everyone else in the community. Because if we're having labor issues and we have a cluster and we don't have access to additional labor, who's going to care for these patients? So we're taking the whole access to our building and services very seriously. We do no longer are doing elective surgeries, um, inpatient, outpatient. We're still doing it if it goes home the same day. Obviously, we're still doing emergency cases and everything else that is of an emergent nature. But anything that's elective that could be postponed in a safe environment, we're doing it.
Well, so on that staffing front, my understanding from the Florida Hospital Association is you're not alone in that problem of there could be a staffing problem across the state, right? So at Memorial with six hospitals, what kind of stress is that putting on your workforce now?
It's huge. Just to give you a perspective, we've added 266 additional beds over the last 2 weeks. By the end of this week, by tomorrow, we'll have 300 more beds. But the challenge, as you've indicated, is going to be the staffing of those beds. And they're not here. We have 700 vacancies just in nursing alone. We have brought in 439 traveling nurses, and we have just approved last Friday an additional 150 to complement the existing staff. The issue is that everyone is tired. Everyone is stressed out. Think about working 4 or 5 shifts in a week, and they're 12-hour shifts in an environment that is very concerning. You have to wear PPEs. It is really something that's what we call them, heroes. And you're going to hear that term throughout because they are heroes. They're in the front lines, and there are no easy solutions. Now, the traveling nurses that we have and respiratory therapists do alleviate some of the shortages. But what we did here at this and the healthcare system is that we created a nursing residency program, and we had 150 new nurses start the residency program between last week and this week. But as you will know, you just cannot take a new grad and put that nurse on the floor. It takes time to onboard and make sure that they understand what they can and cannot do. The other thing that we have done is we did open a fellowship program for nursing, and that's where you take nurses that are already in practice and say, if you want to work in the emergency department, if you want to work in the critical care areas, we provide a program that allows them to graduate to a level of competencies that they can take over those roles. But it has been a challenge. It is 7 days a week, 24 hours a day. People are stressed. There is no easy pipeline because everyone is in the same problem. The whole state is in the same problem. Every hospital that you talk to in the state of Florida, I can only speak for our organization in South Florida, has the ability and the capacity for more patients. We just do not have the labor to care for those patients.
Right. And so, as you think about your current staff, what are some of the programs you've put in place to kind of help them? I know you have kind of this, I think it's called a community services program that um, during the first part of the pandemic, there was an uptick in usage of that. So, can you talk a little bit about just what you're doing to help people relieve some stress?
Absolutely. And we have sessions. We have real-time, the resilience programs that we have implemented here to allow breathing room for the staff to rest, to take time off whenever possible, to have dialogue with social workers that can appreciate the kind of work and stress that they're going to. We provided residential assistance so that the nurse didn't have to go home because of the concern of spreading the virus with their families. So we take that very seriously. The Human Resource Department here has been actively working with all of this. It's not just nursing, by the way. It's respiratory therapists, intensivists, physicians, and allow them an outlet to be able to express and share some of the challenges that they've had and how they deal with those challenges.
And are there things that you found have been pretty effective and useful that, if you think about your colleagues across the country who might be getting ready for a surge, that, one or two things they might want to try to implement now ahead of a surge?
Yeah, no, well, we have identified rooms that are rest rooms so people can just decompress. It is available to anyone who wants to use it. We've allowed them to seek not help, but be able to reach out, if I may, and share their stress levels. There's a variety of programs, and I apologize because I don't know the details of it, but I do know that we have several of them, and they're working. We did even engage on a virtual way to facilitate the ability of the staff to virtually converse with those that can help them deal with the stress levels that they're going through. It is a challenge. I couldn't, it really is.
So we talk about the frontline staff and ancillary staff. Obviously, they're the hero. They're on the front line dealing with this and a lot of pressure that they have to contend with. What about at the executive level? I mean, you're under pressure too. Your colleagues who are running the hospitals, are you seeing a level of stress at that executive, that C-suite level that you haven't seen before over this period of time?
Compared to last summer, it's not the same. Don't forget, last summer during the first surge, PPEs was an issue, staffing was an issue. Having access to ventilators, not having enough of a variety of medications. Remdesivir was not around. That was really stressful. That's 7 days a week, everyone, all hands on deck. Today, we're much smarter. We have adequate PPEs. We have adequate pharmaceuticals. We have adequate ventilators. So we have learned an awful lot from our initial surge. However, there is that stress level. I think their professionalism does not reflect the stress level that you might see in the front lines. And I'm of the opinion that if you're an executive for a reason, and that is to direct. We need to worry about those who are on the front lines and give them the resources necessary to stay safe, be able to provide the care that we want them to provide to our patients, and provide them with the relief valve that they need in order to maintain a safe mental as well as physical environment. But at the C-suite, I have not sensed the level of stress that I've seen in the field. And by the way, I have toured each one of our hospitals several times, and the staff is grateful for the amount of support that we're providing and the resources that we have made them available in order to make their jobs easier, which is not an easy thing to do.
Yeah, I'm sure. And lastly here, as we think about going forward, so as you referenced, you've stopped elective surgeries, that was paused before, pause it again, obviously. What does this do just strategically, operationally? I'm sure you were hoping that we'd be coming out of this and you could get, things back on track. So now you're back in this situation again. What does it do for your strategic planning and operational planning?
Well, we had a strategic plan that was going to be rolled out last year, first quarter of last year, and obviously it came to a halt. We started seeing our first patients in March of 2020. What we have done is we have reintroduce the strategic plan. We've modified it somewhat because obviously one of the lessons learned is that we're much more dependent on virtual consultations and the use like we're doing today in a WebEx. So that has modified some of our plans. It has modified the capital investment in investing more in technology and the ability to create platforms that allows us to create more centralization of services, improving our scheduling, things that were not on the original strategic initiatives. But we do believe that the shift to an outpatient setting has been expedited through the pandemic that we had just gone through, and we as an industry need to be much more dependent on technology. Labor shortages are going to continue. This is not the end. I mean, we were less than 100 patients in late June. Here we are on the 12th of August, and we have 672. Now, yes, it will come down again, but these are waves that we just cannot predict. And unless we have more and more of the population vaccinated, it's going to continue to be spread, and you're going to have different variants to the virus that could be even much more infectious. So we don't know that. So the more we can depend on technology to do virtual consultations and cared for virtually, it's going to be difficult because of the shortages in staff and the resources are not there. We're, as human beings, we can only do so much, and we're at this now for 18 months. It's been a long time.
Yeah. Well, listen, again, we appreciate your time. We know and we can hear how busy you are. So we appreciate you take some time to talk to us and share your experiences with our audience. We wish you the best. We hope you stay safe, and hopefully you guys get out of this in short order.
Thank you, man. Thank you for the opportunity.
Thank you. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup. Thank you.